Here is the new episode of our YouTube series on practical OBGYN problems, where expert faculty share their views on any interesting topics. Since these videos are posted to YouTube, one can watch it as and when time permits them. Our today's topic is contraception in singles, unmarried, sexually active girls and women. It will be presented by our expert faculty, Dr. Gurpreet BATRA. Dr. Gurpreet BATRA is a consultant obstetrician, gynecologist and adolescent healthcare specialist. She works at Hayes Memorial Mission Hospital at Prayagraj, Uttar Pradesh. She is a member of editorial board of a magazine published by Society of Menstrual Disease and Hygiene Management. She is an expert faculty at various obstetrics and gynecology conferences.
Thank you, Dr. Shah, for the introduction. Let's talk about the generation next woman. Single, unmarried women, well-educated, financially independent are found all over the world and are now increasing in numbers over the last decade. Although we are a developing nation, but we still have in India a substantial population of single girls and women. They are sexually active with friends or in living relationships, and it is commonplace to find them everywhere, from tier 2 cities to the metropolis. It is a human urge and within their rights to be sexually active. This is the Gen Next woman. With such women around us increasing in numbers, it is time for us, the obstetricians and gynecologist doctors, to be the Gen Next doctors. We often get such patients regularly at our OPDs seeking contraceptive counseling, management of contraceptive accidents and emergencies. So it is for us to be alert and aware to how to empathetically deal with these women and to give them the best possible options. This is my humble attempt to discuss the contraceptive options for such single girls and women. When we talk about the contraceptive choices for the Gen Next girl, we have the options among the regular contraception and emergency contraception. Among the regular ones, traditional methods like coitus interruptus, safe period or rhythm method, barrier method like condoms, female condoms, spermicidal gels, and of course the good old oral contraceptive pills, which are the combined OCPs and the progesterone OCPs, and a few newer drugs. And emergency contraception is always around for the emergencies. Now I will be talking about in brief about all the methods listed above. So let us start with coitus interruptus, a traditional method of withdrawing the penis from the vagina and letting the ejaculation happen away from the female body in an attempt to avoid pregnancy. The pulling out method prevents the sperms from entering the vagina. It is a safe and economic method but has a very high failure rate of around 5 to 20%, and it has a high risk of infections, which can be both perineal infections and skin infections. The next, calendar or the rhythm method, is a form of natural family planning. It is a method which helps us predict the timing of ovulation, and it helps to determine when the girl is most likely to conceive. So tracking a woman's cycle by monitoring her basal body temperature, watching for the changes to cervical mucus. This method is around 76% effective at prevention of a pregnancy, but it is extremely unreliable, has a high failure rate, and it also depends if the girl actually has a regular cycle or not for this method to be effective. Condom is a sheath barrier device made from latex rubber which can be used during sexual intercourse to reduce the possibility of pregnancy and a sexually transmitted infection. There are both male and female condoms, and the male condoms are more popular, but the female condoms are better for a woman to use as it lets her have her own control if the male partner disagrees. It has a failure rate of around 2 to 8%, but it is an extremely safe, affordable and a readily available method of contraception, and the best advantages to prevent HIV and sexually transmitted diseases. The next contraceptive I would like to talk about is oral contraceptive pills. These are the commonest and the safest method for regular use, along with a barrier like a condom for maximum protection against infections and pregnancy both. Most commonly available are the combination pills, which have a combination of hormones estrogen and progesterone, which the method they act by is to prevent ovulation, and pregnancy cannot occur if ovulation is suppressed. The oral contraceptive pills allow the woman a control over her own reproductive and relationship choices. One tablet every day from day 5 to day 26 of her cycle allows the woman to take control of her reproductive choices. Various combinations in different brands are available, for example, Loet, Femilon, Overall, Mala D, Mala M, Intimacy, Doris. These are also safe, affordable and readily available with minimum side effects like nausea, headache and mild mid-cycle spotting, which all can be managed medically, and the failure rate of OCPs is around 1 to 5%. After the regular contraceptive, let us talk about emergency contraceptives. Emergency contraception is intervention aimed at preventing unintended, unplanned pregnancy after an unprotected sexual intercourse or potential contraceptive failure, also frequently known as morning after pill or postcoital pill. These are the contraceptive methods which are more frequently used by the unmarried and the sexually active girls. All women can use emergency contraceptives safely and effectively. The main commonly used indications of ECPs are unprotected act of sex, condom rupture or slippage, missed pills 3 or more in case a girl is using oral contraceptives, sexual assault, potential pill failure or a recent use of suspected teratogens. The common oral contraceptive pills like Mala D, Mala N, Femilon or Overall, used in a different dosing method, can also be used as emergency contraceptive. For example, Overall tablet, which contains 50 micrograms of ethinyl estradiol and 250 micrograms of levonorgestrel, are most commonly used to provide this specific dosage. That is, 2 pills are given in the morning and 2 pills are given after 12 hours at the night. So effectively, a total dose of 4 pills given in one day act as an emergency contraceptive. Also, pills containing just the hormone progesterone can be used as an emergency contraceptive. Readily available over the counter with the name of Unwanted 72, My Choice, My Pill, Pill 72, SUDHIR, etc. is a levonorgestrel only pill which can be taken in 2 different methods. Either it is 2 doses of 0.75 milligram of LNG, 12 hours apart, to be taken within 72 hours of unprotected intercourse, or it can be a single dose of 1.5 milligram LNG pill to be taken within 72 hours of intercourse. The most common side effects of pills with these dosing is nausea, vomiting, irregular bleeding or a delayed menstrual cycle, headache, dizziness, fatigue, mild breast tenderness. Most of these symptoms are mild and go away on their own and do not need a medical consultation. There are no known medical conditions that make emergency contraceptive pills unsafe for any woman. This is why most of the emergency contraceptive pills are available over the counter to all women without a prescription at most places. But we need to be careful because they are contraindicated in girls and women with allergy to drug components, history of thromboembolism, and history of severe cardiac disease like recent angina. Now I would like to talk about 2 newer methods of emergency contraception that have recently come up in the last few years. The first one is ulipristal acetate, which is a progesterone receptor modulator. A single dose of 30 milligrams within 5 days. So this drug gives us a longer window of usage after the unprotected intercourse. It has been approved by the European Medical Agency and the US FDA and is available on prescription as EC in over 50 countries. A side effect of mild abdominal pain and irregular bleeding is recorded. The second newer method is an anti-progesterone drug, mifepristone, which is widely prescribed as an abortifacient, but for emergency method of contraception, it acts in 3 different ways: as an anti-implantation agent when given after the act of sex, as a menses inducer if given in the luteal phase, as also an abortifacient when given in very early pregnancy, and a single low dose of 10 milligrams within 3 to 5 days of unprotected act is almost a 99.9% efficacy in studies. Now this slide is very important for the generation next gynecologist. We need to be very alert. The use of emergency contraception should always be evaluated for an accidental pregnancy if menses do not begin within 21 days following medication. The girl needs to be advised to stay on follow-up after 3 weeks of taking the tablet. In case of acute pain or bleeding lesser than the usual menses, ectopic pregnancy needs to be ruled out and ultrasound may be required. And also, women and men of reproductive age group coming to a clinic should always be counseled about the use of regular and emergency contraception both, and also about the risk of sexually transmitted diseases, which is potentially a very big problem in this generation of unmarried and single women. A few brief recommendations before I end my talk: that contraceptives should be available over the counter without prescription at pharmacies, family planning clinics, emergency rooms, and also school and college health programs. And when such girls approach us as a doctor, we should not be judgmental of their choices. This is the new normal and we should be ready to accept it and to help them to maintain good health, avoid accidental pregnancies, and to give them appropriate infection prevention and counseling. Regular contraception should be advised as appropriate, and individualized care and counseling is recommended for all such women coming to our clinics. And to conclude, regular usage of contraceptives is always better than emergency usage. I take this opportunity to express my heartfelt gratitude to my wonderful mentor, Dr. Shah, for giving me this opportunity to share my views and make this talk and help the Gen Next woman and the Gen Next doctor. Thank you for watching this video.
Thank you very much, Dr. Gurpreet BATRA, for a very informative and educative talk with slide presentation on a very interesting subject. Friends, please like the link and share it to your friends, your colleagues and students. Please subscribe this channel to view such videos in future. Thank you very much.